The pathological approach in an individual's overall health is the study of the causes of the impacts of the overall disease states, and looking at those labs within that, and those parameters, waiting for a lab to fall outside the parameter before we do anything about it, instead of trying to catch things early and looking at the combinations of labs as an individual. And then a functional approach is just that, the study of the physiological state, allowing for the prevention of pathology. So looking at labs, looking at not just labs, but looking at listening to the individual, listening to the symptoms, signs and symptoms, with the idea of optimizing who they are. AMG conference attendees, they in most of these types of conferences, what do the attendees come to learn about? What they learn about, in this particular conference, we're talking mostly about hormones and how they work together to optimize an individual's overall health. And unfortunately, we get so caught up, physicians and providers get so caught up in advanced knowledge that we forget about the basics. We forget about that, nutrition is medicine. We get these individuals who, we get clinics and providers who we're looking at all the different aspects of someone's health, and hormones in this case we're talking about, that we forget about how nutrition and antioxidants play a role in hormone receptor health, the availability of hormones, and converting hormone that's tied up in a binding globulin, and how to release it into the free state to allow for a physiologic response. We forget about all this stuff. We forget to discuss the HPA axis, stress, allostatic load, epigenetic effects on overall health. We do this because we're trained to think about homeostasis, the balance of things, and we're taught about homeostasis in the basic biology, high school biology, that an individual, an organism, remains in a certain range of physiological parameters to maintain stable function, and whenever there's outside stressors that go outside that range, that your body fights to stay within that range. And that's kind of not how the body works. It's more of from an allostasis or an allostatic point of view, and where the organism constantly varies and adjusts those physiologic parameters to maintain stable function. In other words, these ranges shift, and so if somebody's blood pressure has been a certain way, for example, for in their 20s and 30s, but then they have this what's called allostatic load, these epigenetic changes, poor diet, stressors from above, obesity, poor diet changes, and we're not catching those things early, well, then you get long-term effects of higher blood pressure, poor diabetes, poor blood sugar regulation, metabolic syndrome, insulin resistance, etc. This is just a slide that illustrates all of that. You get this outside stressors, whether it's obesity, whether it's epigenetic changes in a negative way, the allostatic overload, and then that causes, and in this case, we're talking about hormones and all their negative results of all these different changes, including poor diet and poor antioxidant levels. So then you get poor receptor response, and you get decrease in luteinizing hormone, growth hormone, testosterone, estrogen, et cetera, et cetera. And I'm not talking about the perimenopausal woman or the 60, 70-year-old male. I'm talking about 20s and 30s. I'm talking about early on, because we're thinking about prevention, right? So as a result of this allostatic overload, you get advanced, you get obesity, advanced visceral adiposity, you get elevated blood pressures, elevated heart rates, poor insulin action. My wife is a perfect example of this, where this woman that you see here in great shape, has been in great shape all her life, who's a vegetarian since she's been, since she's a teenager, who's always been active, had her first heart attack at the age of 38. So why would that happen? Someone who's a vegetarian in great shape, active all her life, have a heart attack at the age of 38? Because we forget about these other outside allostatic load. We forget about all that her body works in this, our bodies work in a systems biology approach. So when she had these kind of minor complaints through her 20s and early 30s, we weren't thinking about looking at her overall physiologic, all the physiologic parameters to include her antioxidant levels. So after she had her heart attack, she was, of course, well taken care of by the cardiologist, who was taking care of what? Her heart, right? So, so they're taking care of her heart, but what are they forgetting? Forgetting about hormones, forgetting about nutrition, forgetting about, I mean, she's a vegetarian, so we assume that that she's eating properly, and she's not a potato chip ice cream vegetarian. She's an actual had 4, 5, 6 servings of whole fruits and vegetables a day, but that's all we think. We don't think about, is she absorbing? Is she? And so we didn't measure that. So make a long story short, her vitamin D. But I met her 4 years after her MI. Her antioxidant levels, as measured by the biophotonic scanner, was nil. It was 0. It was so low, it was not measurable. This is a vegetarian, right? Her vitamin D levels were I think, in the single digits. Her hormone levels were all over the place and not being managed, because all we were thinking of at that time, or her specialists were thinking of, was her heart, her lungs, but not as a systems biology approach, as a human being who needs to be looked at from the perspective of her overall health. There are multiple studies correlating antioxidant status with optimizing hormone and hormone receptor function. Poor antioxidant levels, low antioxidant levels, whether you're a vegetarian or not, you have to be measured, increase the chances for issues with hormones, including infertility, early menopause, poor sperm production, erectile dysfunction. So what we're being pushed in the mainstream perspective is, oh, erectile dysfunction, we'll give them more testosterone, or give them shots, or medications that help kind of put band-aids on these types of things, but don't actually fix the problem. The bottom line is estrogen, progesterone, testosterone. If you're having issues with these hormones, and you're taking care of these, and you're a physician, and I'm talking from the perspective of those of you who are listening, who attended the AMMG conference. In these types of conferences, we think, okay, someone's perimenopausal, and we got to manage estrogen, progesterone, testosterone, but it's more than that. It's managing their antioxidant status. It's managing the nutrition so that the hormones that they are taking are working. Because we've all had this same patient come in that has been on hormones, and their symptoms are coming back. We don't know why. I've been on testosterone, Dr. Gonzalez, for 2 years, or came from another clinic and have testosterone, but they won't give me more because I'm already maxed out on my testosterone. When we haven't managed their antioxidant status, their nutrition status, their receptor function. And so we don't think of it from that perspective. The animal studies and human studies have suggested that oxidative stress has an important role in follicular growth, in the development of things like endometriosis, infertility, regulation of angiogenesis, so of healthy vascular function. But it's well established. There's nothing new about this, about antioxidant stress, oxidative response for hormone receptor function. We've known about this for years. I suggest you go through some of these citations and take a look at how all this matches, because all of us have outside stressors, and we need to manage those stressors. And oxidative stress plays a powerful role in not just hormone production, hormone receptor function, but in overall physiologic health, brain function, adrenal function, thyroid function. And we don't want to wait till somebody gets sick, until they're 38 years old, vegetarian, having an MI. So the best way to do it, and how I utilize in my practice the biophotonic scanner, is that every single individual that walks through the door, that walks through my clinic, gets scanned. Whether they're here for an aesthetic procedure, whether they're here for nutrition, weight loss, for cancer management, whatever it is, every individual that walks through the door, including the mailman, gets their antioxidant scan, because that's the most powerful screening tool that I can do within seconds that gives me the power to give a narrative of nutrition in that individual's health. We all know that discussion of nutrition is labor intensive. So we all know it's labor intensive to talk weight loss, to talk nutrition when it comes to physicians and patients. We have a short period of time. The biophotonic scanner allows a quick, it gives you a number right away that you can present to the patient and put it right in front of them and say, here it is. You either do something about it or you don't. It's what we do with all our other things too, right? Okay, your cholesterol's 285, your LDL particle numbers are over 2,000. Here it is. Your hemoglobin A1C is 6.9. Here it is. Your antioxidant levels are low. Here it is. And then you do something about it. And so what do I do about it, Dr. Gonzalez? What do I do about it? Doctor who's providing me healthcare? Well, first, we got to make the changes that you need in your diet. And that's the number one thing. The number one thing is not, no, you got to take a pill. No, you got to take a bunch of supplements. The number one thing is change your lifestyle and change your diet. And it brings that narrative right away. The second thing, if you want to escalate that and start right away, is begin supplementation. And powerful responses. I make every single one of my surgical patients not only take the test, of course, but if their antioxidants are low, and even if they're in the right place, I want to maximize that level, right, to allow for maximal healing. And so I put them on the products, and the products that work are the ones that show a level. How do you know a medication is going to work? Docs out there, how do you know a medication is doing its job? You measure. Well, how do you know someone's antioxidant levels are elevated? Well, you measure the biophotonic scanner. And with my wife, who had zero, she had zero, her level was so low, it was not measurable. It took me 18 months with maximizing and being aggressive with her antioxidant, with her gut health, and improving her gut and maximizing the antioxidant intake. It took me 18 months just to get her into the near optimal range, and another 3 years to get her into the optimal range. So it's not going to be easy. It's not an easy thing. It can be, but it's not an easy thing for those people who've had issues that led up to that for years, that led up to a disease process. So this is just a list on this slide. It's just a list of the different things, the citations that correlate with the different things that have to do with antioxidants and all these different issues: sleep deprivation, metabolic syndrome, sex hormone dysfunction, cardiovascular disease, MS triggers, cancer triggers, osteoporosis, autoimmunes. I want to spend just 30 seconds discussing autoimmunes, autoimmune issues. So when I was, keep on this slide. When we're going through medical school, Hashimoto's, autoimmune disease processes were the zebras. Now it's like everybody has some sort of autoimmune issue. Lyme's is prevalent. Hashimoto's, everybody has Hashimoto's and thyroid disease. Everybody has a gluten sensitivity and allergy process, why is that? Well, that's a whole nother discussion, but the bottom line is, if we're not managing the basics, if we're not managing the nutrition, the diet, and if we're not bringing the narrative early, which the biophotonic scanner does, then, people are kicking their own butts, just like this slide. The right tool for screening is the biophotonic scanner. Simple, efficient, effective tool for bringing in the nutrition narrative right away. Here it is, patient. This is your issue, and here's what you can do about it. So think about the actual underlying issues, bring the narrative about small lifestyle changes early in your discussion with the patient. Use the antioxidant screening tool, the biophotonic scanner. Ask the individual who came to you for hormones, in this context that we're talking about here, for hormones, and say, hey, look, I might be able to give you more hormones, but let's make those hormones work. Let's maximize their ability to do their job in your body. You don't want more hormone, you want more efficiency in the use of hormones in your body. And diet, nutrition, antioxidant status, powerful role in